This program is a paid commercial announcement and in no way represents the views of WPH.D or its management.
Talk Radio 1210 WPH.D, WPH.D.HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch, and your host, John Damazzi.
Good morning, Merry Christmas, Happy New Year, Happy Kwanzaa, Happy Hanukkah.
Happy everything.
And happy everything in there, all right?
And good health.
That's right. We hope you enjoyed your holiday and continue to do so. And, of course, our New Year's resolution, which we'll do a week early, is to get you as healthy as we can for the new year. And we are going to bang the drum and all that stuff to say goodbye to 2020. Good riddance, all right?
I think everybody feels
right.
that way.
Health Watch is the show, Sundays, 8 till 9. Talk Radio 1210 WPH.D, as you heard the man say. Dr. Molly Fantasia is here, the PhD doctor and the executive director and founder of Innovative Medical Associates, Marlton, New Jersey. At any time during the course of the show, if you have a question for Dr. Molly, you have a medical challenge, you want to run by her, 855-839-1210 is the number, 855-839-1210. As I said, at any time during the course of the show, feel free to call in if you have a question or a medical challenge for Dr. Molly. Hope you had a good holiday, Dr. Molly.
Great holiday. You know, Christmas is, a good day to celebrate and to remember why we all do what we do.
Yeah, and it's like so much eating and whatever, and it's like I feel like I'm in a fog after 4 days of eating.
Well, you know what, John? You'll feel a lot better on Tuesday.
That's right,
okay? Because
absolutely.
I'm going to detox you.
That's right. That's what I need.
Yeah.
But like we said, if you have a question, 855-839-1210. Talking about health and the new year and kind of making a resolution to feel better, to get healthier, with respect to Innovative Medical Associates, what can you tell people or what can you recommend that they do in order to achieve that goal?
Well, one of the things, John, obviously, is, we believe in natural substances. So we believe in tuning up your immune system in order for your own body and to actually help you and protect you from some of the things that are out there, as you know. So I would say come on in for some vitamin C, come on in for some amino acids, and let's talk a little bit about maybe helping people reduce their need for medication. Don't throw it away. I'm not telling you to give it up. I'm not telling you don't do surgery if it's scheduled for the new year. But I'm saying let's augment some of that so that you live a better quality of life in 2021.
And, I've talked about this before. I came in Tuesday, and you were closed for Christmas Eve on Thursday. It's my normal day.
It's our only real day that we close.
I know. And so it's like I feel like now it's, what I'm saying? You feel like something's missing.
I know.
So it will be a week on Tuesday that I've had.
Yes, and we want you back in the chair.
Right.
Because, again, you have comorbidities, and that's the key. And maybe I have to reevaluate Christmas Eve, but, I always feel that in some respect, it's important for us to take a stand and say, for our Creator, we want to close Christmas Eve and Christmas Day.
And that's what you did, but again, that was just the way it
fell.
I
understand.
But talk about what I'm referring to, and you've often said the reserve. When you get your hydration,
sure,
and that kind of thing, it's kind of a regular thing that you do, and if you don't do it,
you start to miss it. No question
about it. And the reserve it dwindles.
Yes, exactly, because it's like it's like when you have a gas tank and you have a reserve tank.
Right.
Well, now we're into the reserve tank, and
right.
sometimes that happens. Particularly, it doesn't happen all the time with folks who are just perfectly fine in terms of their health. They have nothing wrong with them, which is far and few between.
Right.
But when you have some comorbidities and just the fact of aging and our genetics, what we want to do is change some of that and keep you going. Simple as that.
Okay. Explain your whole philosophy, Innovative Medical, and what you do and how it's different.
Well, we are a primary care facility, and we're cooperative in terms of the physicians who work with me. And our philosophy is, yes, if you need an antibiotic, if you need an antihypertensive, we're going to be able to prescribe that for you. Of course, Dr. Testa is a osteopath, and he certainly understands doing that. And if you need it, you need it. But what we like to do for most of our patients is help them reduce their need for these medications. So let's just say you're on 4 or 5 meds. If we can help you reduce the dosing and maybe maintain the 4, okay. But more importantly, we might be able to reduce the 4 to 2. And by using natural substances like vitamins, minerals, things like amino acids, stuff you'd buy in the health food store, but using it appropriately for you and at a therapeutic level.
Explain the difference, and you've done this before, but for those who may be listening for the first time, explain the difference between what you buy in the health food store and what you deliver via your hydration.
Okay, so let's take vitamin C because that's our favorite. So what you can get in the health food store is like a drop in the ocean compared to what we're able to deliver by the hydration vehicle. Now, that being said, we want to use a dosage that is appropriate to you. So with vitamin C, higher generally is better. But there are some things where we bring them down as well. But I can tell you, the minute something has to go through your digestive tract, you're going to lose some percentage of that. And generally, it's at least 30%, maybe more, depending on the patient.
So what in the long run, the hydration is obviously more potent,
right?
And better for you.
No matter what the dosing, that's exactly right. And I tell people, don't fixate on how much of a particular substance you're getting. Let's look at the synergies of the substances together, and then look at some of the dosing requirements. That doesn't hold true maybe for the cancer patients, because we know certain things at higher doses absolutely effectuate the change and keeps people well during their cancer treatments.
So when you're talking about the hydration and you're talking about the potency and all of that,
yeah,
do you kind of do both? Do you do the,
sure.
the health food store and you do the hydration?
You can, and listen. I tell everybody, come in and talk to my nurse, Barbara. Now, I got to tell you, she will guide you as to what to buy in the health food store. As you know, I don't really have a line of vitamins that per se. I do have a couple of things that I like that you can't necessarily buy at the vitamin store, but very few. And actually, the one that I do have is really more specifically for kidney health. It's a probiotic, which I find extremely helpful for my diabetic patients and people with chronic kidney conditions. So yes, we will guide you as to what the right brands are.
And if you ever want a list, Barbara will be happy to make it for you, which she did for me.
But you know what else I like? I like the idea that we can then together, when we all cooperate, meaning the physicians and the registered nurses and myself and the entire staff, when we cooperate, what we're able to do is we're able to give a particular patient a particular list for them, so that you're not overwhelmed in the vitamin store. That's what happens. Look, John, how many times have you gone in and said, okay, show me where the hypertension stuff is? Guess what? There are rows and rows of it. How do you know which one to take?
Absolutely. And then you ask the clerk and he says, well, I like this one.
Right. And sometimes you get a great clerk. Sometimes you get a great clerk who has a lot of knowledge. And sometimes you get the luck of the draw.
Right, exactly. So in terms of the hydration, you obviously recommend you do both, and you have done that with patients.
Right.
But how often do you get hydration? Like I mentioned, I come twice a week. Some
people come in once a week. Some people come in once every 3 weeks. Some people can manage to go once every other month after a certain point. The question is, have we got the patient to their optimal condition in terms of their quality of life? At that point, we can make a decision as to what we do next. For example, I have a wonderful guy who's with us for cardiac. His name is Jack. Jack and I had a conversation, by the way, over the weekend. I said I would call him, and I did, because right now I think he's on the beginning of his 40th treatment. Now, he came to me with extreme chest pain, arrhythmias, all kinds of things. What we've managed to do, now we did not take him off his cardiac meds. Everybody relax. We didn't say throw your meds away. But what we have done is we've been able to augment those. And it's interesting because he's feeling infinitely better. And this week we're going to do some specialized testing, including hopefully a radiology test to look at the plaquing and see if he has what we consider proteins and build up plaquing, and there's a test out there that can do it.
All right, 855-839-1210 is our number here in the studio. Questions for Dr. Molly. You have a medical challenge you want to run by her. You want to get healthier for the new year. Good time to start. 855-839-1210 is our number here. Health Watch is the show. Sundays 8 till 9. Talk Radio 1210 WPHT with Dr. Molly Fantasia. I'm your host, John DeMasi. We return more of today's edition of Health Watch after these words.
Listen to Talk Radio 1210 WPHT anytime, anywhere on the radio.com app.
Operator standing by right now at Innovative Medical Associates. If you are a little bashful, you don't want to come on the radio, that's okay. You can call the operators, 856-489-0505. That is the number for Innovative Medical Associates. That's the number now. You want to call after the show, you can. You want to call this afternoon, you can. During the week, same number, 856-489-0505. Innovative Medical Associates, Marlton, New Jersey. And as always, the website, innovativemedicalassociates.com, innovativemedicalassociates.com. A lot of good information on the website, and it is updated constantly. So if you saw it last week, you could check it out again. You'll probably see something new. Innovativemedicalassociates.com is the website. Of course, our show is Health Watch every Sunday, 8 till 9, Talk Radio 1210, WPHT. Our number here in the studio if you have a question right now for Dr. Molly. And as we always tell you, you call early so you make sure you get in, because we haven't had it the last few weeks, but earlier in the year, people calling at 2 minutes before 9. So we actually can't get to you then. But right now, open lines, 855-839-1210 is the number. Dr. Molly, we always like to talk about some current patients, and it kind of shows our audience what you can do or what has happened with some patients. And I know you have one that you want to talk about here.
Sure.
I know this is pretty serious for diabetics, and that's a wound situation.
Yes, actually, this nice gentleman's been brought in by his health coach, Joe. And these guys are really smart, Gary and Joe. And I will tell you that he has traditional physicians who've been following him. But as you all know, a few weeks ago, I talked about us culturing his wound. And indeed, we did. And he brought that to his physician, who made a medical decision to utilize that culture. He cultured again, but he utilized our culture, and he's giving him certain antibiotics based on the culture, which is the right way to do it. In the meantime, he debrided the wound, which means he cut off the dead tissue, necrotic tissue. And as a result, he's back in my chair. And what we are doing is we are actually looking at this, and we will absolutely help him through this. And one of the reasons why I talk about this is because in our IVs, we all know vitamin C helps with collagen production, that kind of thing. But we also use some interleukins. You've heard me talk about them. They're proteins. And many times there are certain interleukins like IL-6 that really mediate inflammatory, and they have anti-inflammatory action. So think about that. That means it can help us with the wound healing and speed the process up a bit.
Wounds are pretty serious, and we'll pick that up in a moment, but we got a call.
Sure.
We're going to go to the phones. Frank in the great Northeast. Frank, good morning. You're on with Dr. Molly.
Is this my friend, Frank? Yes. How are you?
I'm your best friend. One of your best,
yes,
one of your best friends. You got a lot of best friends.
No, you're a good man, Frank. I hope you had a wonderful Christmas, Frank.
The best. Thanks to
Good.
you.
Oh, you're very kind.
I got good news. I got a minor setback, Dr. Molly.
All right. Talk to me.
The good news is my mother, after coming there for a couple of weeks with me, not a patient. Well, I call you family and friends. No patients, family and friends. I talked to her over the weekend. This is I'm all mixed up with the holiday.
Yeah, everybody
anyway,
is, Frank.
She's going to be either this week or next week. She's going to become one of your family and friends, because the reason being, she takes me there and she hears everyone talking about how great it is, how great they feel.
Yeah, it's hard to believe. I know, unless you experience it, yeah.
Yeah, seriously. I mean, that's what she told me. I was surprised. I told you she's a stubborn Irish person. Okay?
Nah. Hey, listen, talk to my lovely Linda, right, if you want stubborn Irish.
I mentioned that to her.
Yeah.
And also, there was a priest there from South Jersey. I didn't get his name.
Father Paisley. He's a great guy.
Okay, he said, this is the best place to be, he said. So,
isn't that great? That's great.
And the minor setback, Dr. Molly, is
Go ahead.
Every every Tuesday for 11 months now, the wound care center at the hospital for my foot, the ulcer.
Right.
Wasn't closing up. I was there last Tuesday. Looks good. Getting discharged pretty soon. On Thursday, the nurse came to my house, and I have the wound. The original wound is the same, but next to it, it got a friend. I have a necrotic area that's like in centimeters, 2.7 by 1.7. It's closed, but it's necrotic. They were closed. My choices were go to the ER or wait till Monday to see a doctor. So I'll wait till tomorrow because I didn't want to go to ER. They're not wound care specialist or anything. So
that's right. That's right. That was a
and
smart
I saw
move.
the nurse yesterday. It's still the same size. It didn't get any bigger, but it's a necrotic area. So I'm concerned. And I had I called your office on Christmas Eve. I talked to Fran. I got to reschedule. I'll call tomorrow. I got to. I'll be there this week, but not tomorrow, though.
Listen, Frank, you know what I'd like to do? I'd like to give you that wound wash that we've been using. But, I know you have a home care nurse. And as you know, Dr. Testa and I don't like to interfere with other doctors' protocols. But I really, in my heart, I believe that wash might help a lot. And
Dr. Molly, I'm asking you, please interfere.
Okay. All right. Yes. I what I will do is I think when you come in this week, I want you to leave with the wound wash. And why don't you have your home care nurse give our nurses a call, and we probably can talk to her about why we're using this. And maybe just maybe they'll use it on you, and maybe we can avoid more of this necrotic business. Really, Frank.
Yeah. Dr. Molly, my home care nurse, is experienced. I'm 55. She has 57 years experience. She's been a nurse for a long time.
Oh, she may be very open to this because, she probably, somewhere in there, she might even know Barbara. Yeah. You know what I mean? Yeah. If she's been a nurse this long, But I think we could talk to her about this, and I think it could help make a difference. It's one of the things I wanted to put you on from the beginning. But again, I didn't want to interfere with orders that are already written.
That will help the necrotic area, you think?
I think it will help the one wound that's still open, and if they debride the necrotic area, maybe maybe it will help that as well.
Frank, good luck with that.
Thanks,
and
John. I'm waiting to see you.
We don't talk. Have a happy New Year. Huh?
God bless you, Frank. I'll see you sometime later in the week. Give my best to your mom. She's a smart lady.
Thanks for the call, Frank.
Bye-bye.
Appreciate it.
That's funny.
I want you to talk for a moment, and I mentioned to you off the air that I had an uncle that died from a wound.
Very serious.
Yeah,
very
how
serious
it is.
Very serious. Yeah.
Yeah.
It's not just a little bit serious. It's very serious. It's particularly serious today. If you have to go into the hospital, you run the risk of coming out with a MRSA, an infection that is really stubborn. And lots of antibiotics will not work on it. That's the point. Because, again, what's happening is these bugs are getting smart. Listen, it's happening with the coronavirus right now. These bugs are smarter than us, okay? They know. They mutate, and that's why, again, I'm going to talk to what do I tell people? You got to keep your own immune system up, right? These bugs are smarter than all of us, and they will mutate. So you go into the hospital, you come out with something that is resistant to certain antibiotics. It means you got to go for the big punches and all the side effects that can occur from them.
You've often talked about this. Can you explain again? What are interleukins?
Interleukins are certain proteins, and they're usually found in many of the solutions that we use them. We get our solutions from a company in Italy. They're tincture many times. They can be tincture. And we use them in addition to our IV therapies. And sometimes, actually, they're in some of the products that are touted as stem cell products, okay? So they mediate certain things, and they run the gamut of helping cells get regenerated to stopping over regeneration. So it depends. We have lots of them. IL-6 is one of them. Interleukin 8 is another one. And interleukin 6 that I spoke about earlier is very, very important in eye health. And that's one of the things. I have a wonderful patient who comes all the way up from, Summers Point. Wonderful lady. She's in the bakery business, like for generations, and brought us some great stuff for the holidays. In addition,
I tasted a little bit.
Yeah, she's a great lady. And the thing is, I gave her a book that I have read repeatedly. It was written by an ophthalmologist who believes in utilizing natural substances and certain proteins for the eyes. That you shouldn't just tell a patient, oh, this is all we can do. Yes, if you need laser in your eye, you get it. I mean, that's a fact. But why wouldn't we want to keep your eye in its best shape possible, right? You only get 2 of them, man. So,
Exactly. Talk about, and we're talking about wounds and the seriousness.
Yeah.
When you have a sore, and a lot of people tend to ignore it, saying it'll go away.
No good.
What do you do when you see it?
Well, one of the things you do is you try to find out. It depends on how big the sore is and where it is. But if you're diabetic, I want you to always, always look at that and say that's a potential for disaster, right?
And obviously contact your doctor or healthcare
absolutely,
professional or whatever.
Absolutely. And if you come into a place like ours, we're going to try to give you things that can promote the collagen to help healing, give you IV therapies that help, we know, promote healing, possibly some interleukins to help speed up and hold down the inflammation, and, move some of the white cells to clean up any infection.
So it's something that you're really, and I'm stressing this because every time we talk about this, I think of my uncle.
Yeah, I believe
and he ignored it for years.
Yeah,
ignored it. I mean,
you just can't. You just can't.
And then it ended up going to the hospital and didn't come out.
It's a funny thing. As you know, I've been doing this for 24 years. I've had 2 wonderful, wonderful physicians, including my original medical director, Dr. V, who was a severe diabetic. He came to me in a wheelchair. Dr. V came to me in a wheelchair, and he said he was there on a temporary assignment. And he said to me, my dear, I said, I can help you with those wounds. And he said, oh, my dear, if you do that, I'm going to be your medical director forever. Guess what? He was my medical director till the day he shut his eyes and the good Lord took him home.
Yeah.
But you know what? That can happen. We can help you. That's a true story.
All right, we're coming up on a break. If you have a question for Dr. Molly, good time to jump in here. Health Watch is the show, Sundays 8 till 9, Talk Radio 1210, WPHT. Our number here, 855-839-1210, 855-839-1210. Again, our show is Health Watch every Sunday, 8 till 9, here on Talk Radio 1210, WPHT. Plenty more to talk about here on the show with Dr. Molly Fantasia. I'm your host, John DeMasi. We return. More of today's Health Watch after these words.
Using your hands is overrated. Listen to us hands-free by telling your smart speaker to play WPHD.
Welcome back to Health Watch. As always, operators are standing by. There's no holiday for the operators, all right? 856-489-0505. That is the number for Innovative Medical Associates located in Marlton, New Jersey. You can call them right now. You get more information. The most important thing is, and really, you want to start the new year off right with improving your health, the best thing you can do is make an appointment with Dr. Molly. The initial consultation is complimentary. And that number, again, is 856-489-0505. You can call now. You can call after the show. You can call this afternoon, whatever, okay? And don't worry about calling during the Eagles game because, they don't watch football. They're worried about this, okay? 856-489-0505 is the number. The website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. You could check that out as well. Our show is Health Watch every Sunday, 8 till 9, our live version here on Talk Radio 1210, WPHT. We're going to the phones right now. Rich is in the Northeast. Rich, good morning. You're on with Dr. Molly.
Hi, Rich.
Yeah, good morning. This is Rich, Lucky's daddy.
How are you?
Hey, Rich. How you doing?
Happy New Year and Merry
I'm
Christmas,
okay.
Rich. How you
Merry
feeling, my
Christmas.
friend? Thank you. Thank you.
Improved.
Oh,
I'm not where I
thank
want
God.
to be, but
yeah.
I had heart surgery 3 years ago, and I never fully recovered. And coming to you has really been a miracle.
Well, I want you to know. Go ahead, Rich. Thank you. Tell the folks how you're doing, but I want to say that you coming to us has been a big treat because Lucky's the therapy dog, and we love him.
You know, Rich, what is very interesting, you identified yourself. We know Lucky's the dog, but you come with your wife. You did not mention your wife. You mentioned the dog. I find that very interesting, don't you?
No, he's a great guy. Don't start trouble, John. Come on. Good.
I'm trying to help you out, Rich. I mentioned the wife. This way you don't get in too much trouble.
But
Yeah,
Rich,
I sure do appreciate that, John.
so tell the folks what's going on for you, because you have an interesting story.
Yes, well, I had open heart surgery for an aortic valve 3 years ago, a couple weeks ago. But I also have severe scoliosis,
Right.
and my lungs are all crunched up. So I have
Right.
breathing problems. And
Right.
and you have just been a miracle, and you've given me medication to help me reduce my belly where I hold
Yes.
my fluid that affects my lungs.
Right.
So
Thank God.
thank God. Yesterday, I worked for hours. We have a locker, storage
Wonderful.
locker, and I was able to fill up my old truck with the
Wow.
material from the storage locker, so we can get out of there and not have to pay that
Yeah,
high
monthly.
fee every
Yeah.
month.
Richard, I really appreciate this call, and I'll tell you now, I don't want you to overwork, because I know Lana, as being the registered nurse that she is, she'll keep you going, buddy. So, she's laughing in the background, right? But
Yes.
but you know, and I know that I want you in good health, and I appreciate this call so much. You have no idea, because I think you guys, both of you, you're knowledgeable people. You're intelligent people, and you make it worthwhile for me to come in during the week, because it's like, wow, I've got patients who are thinking out of the box, and that is a wonderful thing for us. And as caregivers, we just love you guys. So thank you, sir. Thank you.
Rich,
May I say one quick thing?
go ahead.
Sure.
Sure.
Yeah, you were talking about the viruses mutating and
Yes.
about
yes.
how you have to be careful with antibiotics.
Yes.
I had a doctor 50 years ago
Yeah.
who was very smart, and he gave me a prescription. I came in, I didn't feel good, I had like a cold, and he told me, he said, you take this prescription, you go home, if you feel better in a few days, you throw it away, because these antibiotics are going to be a problem. And that was over 50 years ago.
And boy, was he a smart guy. Amen.
Rich, happy holidays, and
God
we'll
bless
see
you.
you soon.
God
Say
bless
hi to
you
your
and
wife
Lana.
for us.
Thank you
and we'll
so
talk
much.
to you soon. Thanks
Thank
for the
you.
call.
Wonderful call.
Yeah, well,
Wonderful.
him and his wife come in with the dog.
Yeah, of course.
And I mean, it's a great dog.
Yeah, he's a therapy
He's a therapy
dog.
dog,
I mean,
yeah.
he's really a therapy dog. We
Yeah.
look forward to the visits.
Yeah. All right, 855-839-1210 is our number here. 855-839-1210. I know you wanted to talk about, you have a lot of cancer patients.
Yeah, too many to.
Too many to
Yeah, I want to talk about Mary. I talked about her a lot, because
Right.
she goes up to my consulting oncologist, and I love him because of his approach. He does use conventional chemotherapy, but he uses it in a very unique manner. So that being said, and we do a lot of follow-up. I send a lot of patients there, and I do the follow-up along with Dr. Testa. We do the follow-up in our clinic in Marlton. This has been an interesting thing. Well, a couple days ago, or I guess last week, I just didn't like the way Mary was sounding, because she's usually pretty energetic.
Yes, I
and
know.
she's usually pushing the cause, as
Yes,
you know,
yes.
right? So what happened was I said, I really think we need to run an H&H, or hemoglobin and hematocrit. And I think I mentioned this, that they called at 4:00 in the morning to give me the answer. So the next day I saw her, and she really didn't look too good. So I started to think about this. I called Dr. Testa, and the good news was one of my other docs was there, and she and I talked about it, and she said, I think she needs a unit of albumin, which is 50 milligrams, maybe 2 of those. So we indeed put that into the regimen. So I just want you to know that we use conventional things when needed.
What was
right?
that for? What was that medicine
She was anemic. She was going anemic, and we wanted to expand the blood volume. Okay, so, and we were giving her regular anti, so to speak, the stuff she needs for to counteract, keep the nausea and all that down that she was having. Anyway, I decided to get her in. Of course, I wanted her to go to the hospital. She did not want to go. Now, you have to understand, Dr. Molly, not only do I tell her to go to the hospital, the registered nurse tells her to go to the hospital, and Dr. Testa tells her to go to the hospital. And in addition, I called her oncologist, Dr. Salazzo, who told her to go to the hospital. At the end of all those conversations, she said, I'm not going. So Dr. Salazzo said, well, Dr. Molly, what are you guys going to do? I said, I think we're going to care for her the best way we can. And she comes in with a friend of hers who's a registered nurse. So I'm not saying we take chances, because we don't like to do that. But she's stubborn, she knows her own mind, and she thinks out of the box. Anyway, we treated her Monday, Tuesday, Wednesday, not just with albumin, but with some other things to help raise the blood count. And by Thursday, she was back to her old self. And this week, she goes up to see Dr. Salazzo.
Now, how does something like that happen? Is that just a result of her condition, or
yeah, it's a result of the chemo.
Okay, so but you took care of it in the end. You
the
took care
best
of it.
we can.
Right.
But I mean, look, I want to tell people we are conventional in mindset. So if you need to go to the hospital, we're going to tell you go.
You have had so many cancer patients, unfortunately, but fortunately, you've been able to help a lot.
Of course.
But what are you finding is the most common, or are they all different now?
I think they're all different. I mean, breast cancer, of course, we see a lot of. We see a lot of prostate cancer. We see liver cancers. We see liver cancers of primary site and maybe a secondary. But I think the thing they all have in common is that the folks who have it want to do something to keep their quality of life, regardless of where they go for their chemotherapeutics or their radiation or whatever. And I do believe that we do it well. We can work hand in hand. I get a ton of referrals from a surgeon at this point who is a wonderful surgeon, a young surgeon. She pretty much understands that some people don't want the radical type of surgery, and they understand the consequences of not doing something. That's the thing. The thing is, a lot of things are age dependent too. Where are you in the continuum of life? A decision you might make at 78 might not have been the same decision you'd make at 40.
Exactly.
And that's the key, John.
I wanted to ask you, because everybody asks you this, and I'm sure our audience thinks about it when we talk about things. With your cancer protocols, do they work?
Well, they certainly work to improve your quality of life.
That's the
key.
Right.
And that's the key. Am I curing cancer? No. Do we say it takes the place of some of the conventional? No. But I can tell you that our outcomes have been good when people do a combination. As I always say, John, I've had people who come to me who only do holistic. I've had people who come to me who said they would only do conventional. Both of those groups are not with me anymore. But I've had people who've run the gamut between them. They're still with me.
And you have said that, and you have often said it, that this isn't holy water. You say that virtually every week.
Yeah, because I don't want somebody to misunderstand.
Right. And you've had patients who have come in, and their expectations were too high. And I know that part of your job is to manage expectations.
Right. Exactly.
And
exactly.
that's what
we try to do it.
Right.
But I'm going to tell you something. People who do the research, I think that the folks who called earlier, I mean, they're the people who really, they read, they know where they are. They're informed patients. Here's the thing. Most of my patients are not dumb. They're business people, professional people. They've been around. They know how to read. They know what they want, and they pretty much know their own mind. They want advice. I'm not saying. They want counsel, and that's how they use us. They use us for advice and counsel, not just to stick an IV in their arm. And that's what we like.
We are coming up on our final break of the morning, which means you still have time to jump in with a question or a comment for Dr. Molly. 855-839-1210 is our number here in the studio, 855-839-1210. Our show is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPH.D. with Dr. Molly Fantasia. I'm John DeMasi. We return. More of today's Health Watch after these words.
The Rich Cioli Show, mornings 5:30 to 9 on Talk Radio 1210, WPH.D.
Welcome back to Health Watch. I just thought about this. This is our final show of 2020.
Isn't it unbelievable,
How
John?
about that? Good riddance, 2020.
Yeah, yeah.
You know? Anyway, operators are standing by right now at Innovative Medical Associates, 856-489-0505, 856-489-0505. You can call them, get some questions answered, and you want to sit down with Dr. Molly, you want to make an appointment, that's the best thing you can do. 856-489-0505 is the number. You can call now, you can call after 9, you can call during the week, whenever, but that is the number, 856-489-0505. The website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. Our show is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. And at least for the next week or so, we have our Health Watch replay Sunday mornings from 6 till 7 a.m. We'll return to our replay spot after the football season.
That's great. Okay? That's great, John.
So we'll look forward to that. Speaking of holidays, and speaking of, you want to get a last-minute gift for someone and who has everything, basically, go to the website, innovativemedicalassociates.com, and you'll see a button there, and you just hit that, and it'll really explain to you the skincare line developed by Dr. Molly and well-known area dermatologist Dr. Harvey Glass.
Harvey's a wonderful guy.
It's a great product, and some of the women who have used it in your
They're loving
facility,
it.
they've talked to me, and they've said
they love it.
So that's like a great gift for someone.
I have a funny story to tell you, John. One of my dear old friends from graduate school calls me up and says, "Hey, I heard you developed a skincare line with Dr. Glass." I said, "Yeah, I did." And they said, "Now, Molly, shouldn't you be thinking about retirement?" I said, hey. I said, you guys think about retirement, you conventionalists. I said, we think about other ways to help people.
That's right.
And that's the story of the week. And honest to gosh, happened to me. And I said, wow, they're bringing me back to some kind of reality, right? I don't want to believe it, John. You and I, we're contemporaries, right? But we're allowed to be around. We want quality of life.
You and I should be thinking and should have been thinking about retirement, but we're just not of that. Right?
Listen,
we both. What do we do? If we would retire, what would we do?
I don't know, because my mission in life. I know that most, as I said earlier in the show, most people who come to me with conditions that cause them to think out of the box, and that's what's happening for me too. God
okay, we have a caller, Jim. I got the Cape May. I didn't get the name of the person.
Kathy.
Huh? Anna?
Okay.
Lana.
It's Lana.
Oh, Lana and Cape May.
Yes,
Lana, good morning.
Hi. You're down in Cape May, hey guys? Good. God bless you.
Well, Dr. Molly, I would ride from Timbuktu to see you. That's the truth. Yeah.
Oh, you're a good lady. Well, Lana's a registered nurse and very well known. She's a darn good nurse and smart. Thinks out of the box, right, Lana? God bless you.
Yes, I do, Dr. Molly. And you are a blessing to me. I was on my way to Margate for a private duty case months and months ago, and I was in pain and a lot of inflammation. And I was asking the good Lord upstairs, oh, please help me. And there you were on 1210 Talk, talking about anti-inflammatories and whatever it was. And I said, okay, answer the prayers. Thank you, God. And that week I called, and that was the beginning of a beautiful journey. And not only do I come to you for relief from this horrible inflammation that because of the wounds, I shut the car door on my leg twice. I had a knee replacement go wrong. But here's the other thing. You're very involved with us. You come into the infusion room, you ask what's going on. If there's something that that we're not getting, you make sure we get what we need. And I feel like blessed to have a family. The patients, I love your patients. I can connect with them. I have a Dr. Molly family, Rich and Lucky and I. When we turn on Lippincott Drive, Lucky starts to cry because he knows he's going to see Dr. Molly. It's just wonderful. It's wonderful.
Well,
but I have a question. Thank you.
Shoot.
I have a question.
Shoot.
I'm dealing with candidus.
Again.
And again, it's a chronic problem that rears its ugly head. And as I talk to other people, women, my patients, it seems to be a problem, and I'm asking for your expertise.
Well, I appreciate that, and I will tell you, I think Candida needs to be treated both with a certain type of IV, but it also needs to be treated with the traditional meds. Now, the biggest problem, Lana, is that most physicians who do conventional physician, like whether they're primary care, etc., they don't believe in many times in systemic candida. I happen to believe in it. I've seen it. You definitely have the antibodies for it because we tested for it. So we know that there is candida rears its ugly head. So I think when you come back, I'm going to definitely use some things that help in this area. I also think there's some homeopathics that will help, and I'm pretty sure we can help straighten it out. But the problem is, Lana, and this is a universal problem, not just for women, but for men too. We can pick up candida in a lot of our food. For example, some cheeses, wine can have some candida spores. I mean, it's everywhere. But I think we can help get it under control for you, honey. Okay? Come on in.
Thank you.
I love you.
All right, Lana.
We'll see you this week.
Thanks for the call.
Okay.
Thank you, and Happy New Year.
Happy New Year. Healthy, too.
That's a problem, that candida.
It's in a lot of places. Right. Sometimes a lot of my cancer patients have it as well, because sometimes the conventional drugs depress their immune system, and although they're feeling better and we keep them going, it's still not strong enough to fight against the molds and that kind of thing. There's so much of it out there. Like I said, cheese has it. So we got to watch what we're doing and what we ingest, because then it becomes a systemic problem.
So if you were to make a New Year's resolution, what would it be?
For the candida patients, or for me?
For anybody.
Well, for me, it's going to be that I want to work more, not less. And I think what I want to do is I want to really help people understand that they're not defined by their condition, that there is hope. And it's different for everyone. The hope is different from everyone. But if we can improve your quality of life, even 25%, even if it's a terrible, terrible illness, then we can make you feel better and have a better outlook. And I want to see that we get out of this virus, this pandemic, and that we all have healthy and prosperous New Year for my patients, myself, and maybe for the whole country.
And we ran out of time. But we should mention that next week we'll start discussing seriously the new men's health program.
Absolutely.
And that's
quality of life right there.
That's really going to help a lot of men.
Amen.
So we'll talk about that
Thank
as well.
you.
And looking at the clock, that's about it. Putting the wraps on another edition of Health Watch. Don't forget, operators are standing by. They'll be there well after we leave you at 9 o'clock. 856-489-0505. 856-489-0505. Innovative Medical Associates, Marlton, New Jersey. Check out the website. You want to get that skincare product for someone on your gift list. InnovativeMedicalAssociates.com. InnovativeMedicalAssociates.com. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, Barbara, delightful Dee, fabulous Franny, Joanne, and our nurses, Jess and Crystal, and our medical assistant, Kathy, I'm your host, John DeMasi. Thanks for listening. Happy New Year. We'll talk to you next year. Health Watch, next Sunday, 8 till 9, Talk Radio 1210, WPHT. You take care.